way to the VCA Animal Hospital, and they are specialists in animal oncology and in general care for your animals. So come on, let's go. There's an epidemic of cuteness here. Look, little Chihuahua cuteness. Hello. What's your name?
Yeah, animals actually get, the exact same types of cancers that people get, and that's what still surprises me even today when we have owners coming in that didn't even realize that animals get cancer to begin with, let alone all the treatments that are available for them.
Tell us about the different kinds of treatments that you have.
Yeah, one of the most exciting things that we're doing right now is that we're one of a couple of places in the country that are actually performing bone marrow transplantation on dogs. So with the transplant, what we're doing is not only chemotherapy, but we also incorporate radiation therapy into the mix. Nowadays, what we can offer to a client is the chance at potentially curing them. This is Ashton. Ashton's a dog who was transferred to us from another state to complete his chemotherapy. He has lymphoma, which really is one of the more common cancers that we see. So his unique story is that he also has a torn ligament in one of his back legs. So in order to keep him comfortable, he wears his little boot just to keep his joint intact. It's not a painful thing, it's just that his joint is very lax, it's very loose, and if he doesn't wear the brace, then his back heel just moves in all directions. If his cancer is fully controlled, then he'll stop the chemo and we'll just start the rechecks. But if the pathologist returns a report saying that his cancer is not quite there, then we'll go ahead and treat him for another month and then recheck him again. But he's doing really well. His owners, are ecstatic. He's acting normally at home with his little brace, and hopefully the pathologist returns a good report.
Good, good, good.
But he's a cutie. This is our donor colony of cats, and what they're cats that are either abandoned or rescued, have no owners. And what we do here is, because we have a large need for cat blood, is the requirement for these donor cats are that they're obligated to donate their blood for a year. But after that 1 year of commitment, then we find them good homes to place them into.
How often do you place them in the homes?
We're placing cats all the time.
Okay.
The cat that you met downstairs, that used to be a donor cat.
Aww.
So that's one of the ways we advertise for them, is once they've put in their 1 year commitment, then we commit to them that we will find them a good home. And that, one of the ways we advertise is by placing them downstairs so people can see them. But we also advertise online and through handouts and brochures. So this is Elvis. Elvis is one of our star patients here. He presented to us a couple of weeks ago. He has multiple nodules throughout his lungs and also has some nodules in his spleen. So he's been on treatment now for a few weeks, and presently the owner's reported him to be 100% back to normal, which is what we like to see. Good boy, Elvis.
Oh.
Good boy, Elvis. You're a good boy.
I hear you're feeling better. You feeling better?
Yeah, so when we first started with him, he wasn't bearing any weight on that right back leg.
And now he is.
Yeah, and now he's walking pretty sound. But he was on, we had him on some pretty heavy narcotics for the first week, just because he was so darn uncomfortable with that cancer. And now he's off all his pain meds, just on some supportive things and back on track. So Elvis, is getting his second round of chemotherapy here. He had his first round a couple of weeks ago and did perfectly fine with it. So he's scheduled to get a total of 5 doses, today being his second. But this is our preference for giving them chemo is, we'll have one assistant giving the patient lots of loving while the other one's actually administering the treatment. So the first step of giving him these treatments really are to get that IV catheter placed. And the catheter has to be placed precisely, cleanly, to ensure that the drug is ending up where it's supposed to be, which is in his vein.
So how do we know if your animal has cancer? What are some of the warning signs and symptoms?
Some of the telltale signs would be, lumps and bumps that weren't there, especially if they're rapidly growing. Changes in your pet's weight, changes in their habits in the home. The recommendation from us is that once a year they should be seen by their regular veterinarian for a good annual exam.
Okay, well, thank you. It was really great and informative, and I hope that you learned a lot and how to help your animal.
Yeah, I enjoyed it. Thanks for coming.
Thank you. If you'd like to see your business on Beauty Bites, contact us at beautybitesone@gmail.com.